Now, I think it is extremely important for us to be out in the community, taking care of those that need services the most. And one of those groups, obviously, are homeless individuals. In Long Island, we've got about 4,000 homeless individuals that need extraordinary help. Many have fallen on bad times through no fault of their own necessarily. Others obviously have more complicated issues. So I think it's part of our obligation to be out there helping those as much as we possibly can.
My name is John, and I'm homeless.
John, how did you end up in this situation?
Well, I had gotten divorced. I moved in with my mom and my stepdad. My mom developed dementia. She ended up in a nursing home. So my stepdad was like, well, she's not coming back out of the nursing home, so I'm selling the house and you're pretty much on your own.
My name is Ambrose Orban, and I'm a United States citizen for 40 years. Unfortunately, life became sweetheart to me in this end, and what happened, I became homeless.
Well, when I lost my job, the corrugator moved to another state. The union sent the people for the rest of corrugators for working in, but I don't have the document, my paper, I get off because my work permit expired.
I was a subcontractor for 20 years. Then I opened my own company. I was a GC, and everything went chaos for divorce, and everything fall down. Economy went bad, and I couldn't get up on my feet, and forced to be where I am right now. I've been in this situation about a good 11 years. I'm homeless, living in the woods. I do the best I can.
And what's that been like, being on your own in the last 2 years?
It sucks. Yes, it's not easy, living in my car,
I've been involved with this issue for a long time. When I was in state government, the homeless issue was part of my responsibility, so I'm very familiar with the issues and the complexities and the difficulties, but also understanding of the opportunities. So what we're doing here is to reach out to provide services to those families, working with the Coalition for the Homeless. It requires, obviously, the cooperation of a lot of other people, but I think this is part of our community mission.
I'm Greta Gorton. I am the Executive Director of the Long Island Coalition for the Homeless. The most important work that the Coalition for the Homeless does is make changes. We have changed the face of homelessness. We have changed how homelessness is addressed in our region. Our main focus really is on improving the delivery of services, creating policies that help address homelessness and the causes of homelessness, and really come up with solutions to end homelessness in our region.
I'm Dylan Schwartz. I work for the Long Island Coalition for the Homeless. I do street outreach in Suffolk County. My role as a street outreach specialist is to work with those who have been homeless on the streets in Suffolk County, primarily those who have been homeless for over a year, and helping them access permanent housing programs.
So our partnership with Northwell has been instrumental in helping us work with these folks, get them connected to other healthcare, but even more importantly to start with is getting those diagnoses so we can help them apply for permanent housing with appropriate documentation, with the ultimate goal of getting them off the streets and into permanent supportive housing.
Yeah, we got a psychiatric evaluation done, which will then hopefully qualify him for SPA housing. So we have to still do the application, but we have step 1 completed, which is getting the evaluation done.
We're only as healthy as the unhealthiest, most vulnerable community member in our community. So reaching out and doing these things, whether you're handing out a bottle of water or a pair of socks, or you're checking somebody's blood pressure, that's us. That's Northwell all day long.
Northwell is providing staff, doctors, nurses, and others who will go out with our teams to provide essential medical services to the folks that we're serving.
I'm Edgar Stern. I'm Senior Director of Operations with Community and Population Health. We want to break down walls in healthcare and bring care to the most vulnerable in our society.
Now my eyes bother me because my vision is blurry because I diabetic.
They helped us to get my operation done. I needed a hernia operation.
Years ago, I used to do home care, and today really kind of brought me back a little bit to that, because this is, essentially where we were at was their home, and how can we kind of help fix the problems out of the box.
Everyone deserves medical care, and bringing the medical care to them is the only way these people are going to get medical care.
One of the ethos of street medicine is to go to where the people are. So I think what we're trying to put together with this program is something that is mobile, something that's powerful, something that's impactful, but something that brings out important resources to this community.
This work in the future, it's going to remind us of purpose, of why we went into healthcare in the first place, of why we're here to serve people. And so the program will grow, it'll evolve, but I can assure you it will impact this community, it will also impact Northwell Health's team.
You guys gave me a good choose.
Yeah.